We shall be talking about lymphatic drainage and association in this lecture. There are 11 lymph node clusters that you need to know for the USMLE or the complex exam, and we shall be looking at the areas of the body that's been drained and the associated pathology you need to know for the board exam. So here you can see an image of the lymphatic system. So we shall look at lymph node clusters, areas of the body drained, and associated pathology. So there are two main ducts you must know for the board exam. The first one is the right lymphatic duct, and the second one is the thoracic duct. Here in this animation, you can see here, we have the right lymphatic duct right here. Now, the right lymphatic duct drains the entire right side of the body, anything above the diaphragm, into the junction of the right subclavian and internal jugular vein. So here is your right subclavian vein, and this is the right internal jugular vein, and you can see here we have the right lymphatic duct draining straight into it. Very, very important for you to know for the board exam. However, on the other side, we can see here the left thoracic duct. All right, that is another key important fact because the left thoracic duct drains everything into the junction of the left subclavian and internal jugular veins. Now, what pathology do you need to know for this lymphatic system? Well, if your patient has a penetrating neck trauma, right, somebody gets stabbed in the neck and basically lacerates the left thoracic duct. Now, all the contact of the lymphatic system is going to drain right into the thoracic cavity, causing a chylothorax. Chylothorax, very, very important, high yield fact to know for the board exam. Take a look at the lymph node cluster, starting with the cervical lymph nodes. Remember, these are clusters of lymph node around the cervical region, right? So these are all the lymph nodes just around the neck. And usually around the head and the neck is the areas that have been drained by the cervical lymph nodes. And what associated pathology do we need to know? Well, patients that have upper respiratory tract infection, you have streptococcal pharyngitis, right? Upper respiratory infection, the viruses, infectious mononucleosis. These patients are all going to have enlarged lymph nodes, right? They're going to have lymphadenopathy around the neck region. Also, patients that have Kawasaki disease are going to present with lymphadenopathy of the cervical area, okay? That's what you need to know for the board exam. Now, let's talk about the mediastinal lymph nodes. These are actually around the trachea and the esophagus, okay? So they're going to be right around this region here, okay? Now, with mediastinal lymph nodes, associated pathology is usually a primary lung cancer metastasized usually to mediastinal lymph nodes or patient with granulomatous disease. Now, the next lymph node cluster is the hilar lymph node, right? This is where the hilum kind of sits around this area here. Well, with the hilar lymph nodes, we're talking about the areas that be draining will be the lungs. The lungs drain into the hilar lymph nodes, and thus patients that present with granulomatous diseases also can have associated pathology with these lymph nodes. What about the axillary? Okay, here's the axillary lymph nodes, right? This is where the axillary lymph nodes are, and they drain the upper limb, the breast, skin, and anything above the umbilicus. Well, when are you going to see enlarged lymph nodes around the axillary lymph nodes? Well, when patients have mastitis, right? When you have inflammation of the breast, well, the next lymph nodes are going to be the axillary area. So automatically, these are going to be developing a lot of pain in the axillary region, which is usually a lymphadenopathy. Also, the biggest thing is metastatic diseases such as breast cancer. That's super high yield on the board exam because what happens is a patient with breast cancer metastasizes straight to the axillary lymph node. That's why they get axillary lymph node dissection. Whenever a patient that's undergoing either a mastectomy, they want to make sure that the lymph nodes are already not being attacked by the cancer, so they might need to do a lymph node dissection. Also, once you harvest these lymph nodes, patients are going to get a unilateral lymphedema of that extremities. So that, and usually that's one key important fact because the lymphatic system cannot drain that area of the body anymore. Now let's look at the celiac region. Now, the celiac region is right around this area. You can see these lymph nodes here. All right, that's around the celiac region. Well, what do they drain? Well, they respond for draining organs such as the liver, stomach, spleen, pancreas, and the upper duodenum. Also, the superior mesenteric lymph nodes also within this region, and they will be draining the lower duodenum, jejunum, ileum, colon to the splenic flexure. Also, finally, we have the inferior mesenteric lymph nodes, right? They're just like around this region also. With inferior mesenteric lymph node clusters, they drain the colon from the splenic flexure to the upper rectum. Now, what pathology do you need to know for the board exam? Well, how about patients that present with their right lower quadrant abdominal pain? I know what you're thinking. Appendicitis, right? Well, hold that thought for a minute. We'll call it like a 10-year-old boy who presents a right lower quadrant tenderness, and then patient eventually gets a abdominal CT that shows lymphadenitis around the right lower quadrant. Well, that's called mesenteric lymphadenitis. Okay, they're basically a bunch of painful lymph nodes in the right lower quadrant, and it will present and look like an appendicitis, but it's really not. It's actually just inflamed lymph nodes, usually from a viral infection patient has been exposed to previously. Now they present with abdominal pain in the right lower quadrant. So that's one of the key things that you'll notice with the celiacs, superior mesenteric and inferior mesenteric lymph node clusters. The other pathology is patients that have typhoid fever or ulcerative colitis or celiac disease will also have basically lymphadenopathy in the abdominal region. Now, the next one is known as the para-aortic lymph node clusters. So here, these are very, very important, okay? Here we have this para-aortic lymph nodes, right? Basically, they're kind of highlighted here. You can see them. And basically, line parallel to the aorta. Now, they usually drain the testes, ovaries, the kidneys, and the uterus. So the only time you're gonna notice a patient that has a lymphadenopathy or pathology associated with this lymph node is if they have metastasis, right? Patient with testicular cancer, right? Patient with ovarian cancer, renal cell carcinoma, or uterine cancer will always have pathologies associated with lymphadenopathy around this para-aortic lymph node. Also, the next one is the internal iliac lymph nodes, right? Here are your internal iliac lymph nodes, where they usually drain the lower rectum to the anal canal, usually above the pectinate line, the bladder, vagina, especially the middle third, and the cervix and prostate. And also you have the superficial inguinal lymph nodes. Here are your inguinal lymph nodes. Those are the superficial inguinal lymph nodes. They're responsible for draining the anal canal below the pectinate line. Okay, remember the internal iliac drains the anal canal above the pectinate line. That line is very, very important in delineating the rectum. So they also drain the skin below the umbilicus, except the popliteal area, and also drain the scrotum and the vulva. Now, when are you going to notice a patient that have inguinal lymphadenopathy, right? Usually with sexually transmitted diseases, okay? So patients with STDs are going to get these lymph nodes basically painful, and typically that's what patients complain of. I feel a lump right in my groin. Well, it's because either you have an STD, if a patient has a perirectal abscess, for example, they're going to develop this enlarged lymph nodes, especially if it's an internal lymph node that's actually enlarged. Now, the last but not the least is our popliteal lymph nodes, right? This is the popliteal lymph node clusters. Now, those are ones that drain the dorsolateral foot and also the posterior calf. And often the pathology associated with it are the foot or leg cellulitis. So if a patient presents with cellulitis of lower extremities, they develop redness, painful lower extremities, warm to touch, right, skin erythema. This is usually because they have a cellulitis of their lower extremities. They're going to have a lot of painful or a lymphadenopathy right around the popliteal area, right behind their knee cap, and usually that's what the patient complain of. Is because they have basically a nearby infection. So what I try to explain to patients or to students is that when a patient is complaining of a lymphadenopathy, that's usually a nearby infection that's not that far away, that the lymphatic system is basically sampling the antigens and they're getting reactive lymphadenopathy. These are all the lymphatic drainage associations you need to know for the board exam. Thank you very much for watching. Have a great day. Bye-bye.